All right. Hi, everybody. We're going to be getting started here in just a minute. Before we dive in, just a couple of housekeeping pieces. Since there's so many of us on the call, we're going to have everyone on mute, but you can ask questions at any time during the chat. So if there's at the top of the Zoom link, you can open chat, send a question to either the panelists or to the whole group, and we'll make sure to respond to those. If you have a question that you'd like to kind of ask verbally, just also there's a raise hand feature, or let the panelists know and they can unmute you to ask a question. But thank you all so much for joining us today. I know this is a really stressful time for everybody, and so we're really thankful that you're taking some time out of your day to learn some coping techniques, and just to kind of be together as a community as we all get through this. So to kick it off, I wanted to start off with the relaxation practice. We're probably all feeling quite stressed, so this will be just to get us into the right mindset as we get started. So this is an exercise called deep breathing. Folks might be familiar with this already, but the idea is that when we're really stressed out, we tend to breathe really shallowly into our chests. And so for this practice, we're going to instead breathe deeply into our stomachs, and we're going to make sure that our inhale is shorter than our exhale. So we're going to have a nice long exhale here. And feel free to join along. I would recommend it. If you're in a place where it's comfortable to, but rest them gently in front of you. And if you can, putting one hand on your chest and one hand on your stomach. And just notice how your breathing is. Are you breathing into your chest or are you breathing into your belly? And on your next in-breath, I'm going to ask you to intentionally breathe deeply into your stomach, breathing in for a count of 4 if that's comfortable, or adjust as you need. 1, 2, 3, 4. And then breathing out for a count of 6. 5, 4, 3, 2, 1. In for a count of 4. And out for a count of 6. In for a count of 4, imagining your belly filling with air like a balloon. And then out for a count of 6. Or imagining your stomach deflating as all the air leaves. And taking just 1 or 2 more deep breaths at your own time. Okay, now that we've jumped in, hopefully everyone's feeling a little bit relaxed, tech issues aside. I love deep breathing because I think it's a great exercise you can do. It can be really quick. You can do it at your desk, whatever you need. Before we dive in, a little bit of background about myself. My name is Dr. Myra Altman. I'm a licensed clinical psychologist. I head up clinical care here at Modern Health, and we're so excited that you've joined us today. I specialize in anxiety, adjustment, health psychology, things like cognitive behavioral therapy. So I will be pulling from a lot of these techniques as we go through this presentation. I did want to just note that this is not a therapy session, and so this doesn't just take this all as kind of some education and hopefully helpful pointers, but we do want to encourage you all, if you're feeling very stressed or overwhelmed, to really connect with a specialist for those types of services, whether that's therapy, coaching services. If you have Modern Health, now is a great time to take advantage of that benefit as well. So today we're going to be talking a little bit about uncertainty. There's a lot of uncertainty happening now with COVID-19, with coronavirus happening. There's a lot of unanswered questions. So how do we cope with that type of uncertainty? What type of reactions you might anticipate in this type of stressful time? And then we'll go through a whole range of tips and techniques, what might help in situations like this, what's going to be a little bit less helpful. And I'm going to scatter some active stress management techniques and relaxation practices throughout. So we kicked off with deep breathing, and we'll do 2 more of these relaxation practices throughout. And just a reminder for anyone who's recently joined, feel free, we love questions, feel free to throw them into the chat. You can send them to everyone or to our panelists, and they'll make sure to raise them. All right, first I want to start off talking about stress, anxiety, worry. What are all these different terms? We know that it's a really high stress time. We haven't really had an experience like this in any recent memory. And so I wanted to just at the outset talk a little bit about the difference between worry, stress, and anxiety, because they're very different things and require a very different response. So let's start talking a little bit about worry. And I'm guessing that this is something that probably all of us have experienced in the last few days. Worry is when your mind is dwelling on negative thoughts. We often use this motion because it's repeating the same pattern. You're worrying about the same things over and over again. And it's a very mental process, not necessarily something that's happening in your body. And one thing I want to really call out here too is the difference between worry and problem solving. Often when we're worrying about something, we feel like it's productive, we feel like we're doing something useful, but really we're just going over the problem over and over again. I had someone once describe it to me as, I just feel like I'm admiring the problem. And it often just gets us more and more worried. And instead, what can be really helpful is moving to more of a problem-solving mindset. If you notice that you're looping around in this mental worry spiral, what are steps you can take to improve things? If you're worrying about something that you have control over, are there steps you can take? In situations like we're experiencing with coronavirus, with COVID-19, some things are within our control and some things are not. So we might be able to take steps in terms of hygiene practices. We might be able to check in on loved ones, but there are pieces that are out of our control. So learning to notice the difference between those two. So that's a little bit about worry. The next is stress, which is a little bit different. Stress is our body's response to something happening in the environment. It's a very evolutionary response that's just saying, hey, there's something going on in the world that you should pay attention to and respond to. So we tend to feel this in our body. And this is what we can think of as the fight or flight response. You might feel butterflies in your stomach, you might feel shaking, shortness of breath, lots of symptoms like that kind of indicate my body is telling you that there's something I should worry about. It's not a mental process, it's really a body-based process. And then anxiety usually happens when there's a lot of stress. And now it's a combined mental and physical process. So your mind is worrying and your body is feeling all these physiological symptoms. And that's really what we think about as anxiety. So hopefully it's helpful just to get a little bit of a landscape of how these are different. A lot of the techniques that we're going to talk about today will impact either worry or stress or anxiety. So worry is really the mental process, our minds dwelling on something negative that's happened. Stress is our body's physical reaction. And then anxiety is the combination when we have a lot of mental worry and a lot of physical stress. And we're going to talk about strategies for managing all of these. Obviously, we know that this moment that we're in now, there's a lot of uncertainty and there's a lot of stress. So I'm going to talk a little bit about certainty in general and how in particular we can manage it during this time. So from my clinical practice, I know that managing uncertainty is one of the hardest things for people. We like to have answers, we like to know things. And in a time like this, there's a lot that is still unknown. And so there's a lot of things that we can think about and do to kind of manage our uncertainty. The first is being smart about finding answers and taking action. We think it's really important for everyone to be staying informed and making sure that they're getting their news from reputable sources, whether that's the World Health Organization, the CDC, and following that guidance. What I've been seeing a lot of is there's a lot of people who are just getting as much information as possible And so that might mean checking the news multiple times a day. It might mean checking Twitter, Facebook, news accounts, asking lots of people, and it ends up being this loud cacophony of voices that it's really hard to filter out. So one of the things that can be really helpful is to limit the number of sources that you're looking at. Pick your 1 or 2 sources that you'll go to, and limit the number of times that you're checking for updates. So maybe you're checking once in the morning and once at the end of the day, and really not indulging in too much checking in between, because that's likely to increase worry and anxiety. One other tip I will give around that. So another tip is to make sure that you're starting your day and ending your day as calmly as possible. So I know a lot of folks are waking up, reaching for their phone, and checking the news, right? Give yourself a little bit of buffer in the morning. Wake up, have some coffee, have a glass of water, go for a walk if you're able to, and then check the news. I think if we don't start our day in a mode of panic, it can make the rest of the day go a lot more smoothly. Similarly, at the end of the day, sleep is one of the biggest things that's impacted by stress and anxiety and worry. Try to have a buffer where you're not checking the news, you're not reading about it, for at least an hour or so before bed, so that you can calm down, you can relax, and it's maybe less on your mind right before bed. The next suggestion would be to distinguish between problem solving and worry. So as I mentioned before, right, worry is this mental process where we're running through the problem over and over in our mind. And that's just going to build up our stress, build up our anxiety over time. So starting to notice when you're doing that, if your mind's just spinning on a problem, and instead seeing if you can move to problem solving. Are there any actions you can take that will kind of help keep you safe or help manage your anxiety? So for folks who are fortunate enough to be able to work from home, that might be an option. Making sure you're washing your hands when you return in from anywhere, but then letting go of the rest of it, learning to just say, okay, these things are out of my control. Let me focus on the things I can control, and then distract if necessary. The last point I want to mention is that humans, while it's really hard to manage uncertainty, a lot of us deal with a lot of uncertainty all the time. We're better at it than we think. And so knowing that we're very resilient, we're very adaptable. If folks are aware of the research that's been done on, if people win the lottery or if people become paraplegic, they tend to bounce back to right where they were before. We're incredibly adaptable. And so I really strongly believe we'll adapt to this as well. But it will take some time, but just know that we have that ability to adapt. I also want to just take a minute here to speak specifically about some of the discrimination that we're seeing come up. In times of intense stress and fear, people make a lot of assumptions. We want to find certainty, and often that might lead to blaming others or blaming a specific group of people. So if you notice that you're doing this potentially, that might be a really good signal that it would be a great idea to reach out to support, whether that's therapists, coaches, to find a more helpful way of dealing with your stress and anxiety. Obviously, there's no one group that's responsible for this, and kind of making sure that we're not falling into those traps. On the other end, if you've found that you've been discriminated against, we've unfortunately been seeing a lot of this happen across the world. Totally understandable that you'd be angry, distressed, feeling a lot of reactions. Just want to kind of put a note out there that please do reach out, get some supports. Hopefully there's a lot of folks in your community that can be a really good ally and help support you in addition to professional support. So I just wanted to make a note on that, because discrimination is very common in response to fear, but is not a very helpful response. And this is a time for us all to rally together as a community and support each other. Okay, let's dive in a little bit to what common reactions might be in situations like this. So if there is a stressful event, whether that's personal or on this global scale, distress is really common and it's expected. So if you are sitting there and feeling stressed, feeling overwhelmed, and thinking, this is just me, there's something wrong with me for feeling that way, not at all. This is going to be a very normal response. Some common reactions that maybe you're experiencing or people around you are experiencing: emotional responses. So people might be feeling anxious, fearful, Some folks might even be feeling angry, withdrawn, kind of lost pleasure in things that are going on around you. That's an understandable reaction given what's happening at this societal level. You might also notice that your behaviors have changed. You might be more overprotective. You might be turning to substances, trying to keep excessively busy. Maybe there's some isolation that's happening even more than what's recommended, or avoidance of things. So just keep an eye out if you're starting to have some of those reactions. Again, not uncommon, but just keep an eye on it as well. We've talked a little bit about thoughts as well, but these reactions are common. So it might be harder to concentrate at the moment, right? It might be harder to focus on your thoughts, on your work, and you're kind of caught up in these thoughts. You might experience distraction, memory problems, might start blaming yourself for things, blaming other people. Again, common responses. It's important just to start to notice if that's happening for you, and we'll talk about techniques to manage it over time. And then there's a physical aspect to this, right? So I'm, for example, someone who I tend to notice the physical sensations first. Maybe I'm more tired, I have a headache. For others, you might notice the other areas first. We see a lot of tension, pain, stress responses, difficulty breathing, etc. These are all very, very human reactions to what's happening, and they're not necessarily in and of themselves problematic. So if you're feeling, on top of feeling all these, blaming yourself, know that this is just a common set of responses, and there's a lot that we can do. So someone is raising a really great point in the chat here, and they found that it's really helpful to ask themselves, is what I'm doing or thinking helping me or harming me? If it's not helpful, if it's not a functional, then choose something else, do something else, pick a different activity, go for a walk, have a drink of water. Oftentimes doing things that we can incorporate our 5 senses, so splash water on your face. Surprisingly, holding an ice cube in your hand can be a really effective distraction technique. Very often in situations where there's not a lot of certainty, there's nothing we can do, and so we just have to acknowledge that, and that it's not helping us or anyone to keep worrying or keep stressing. So finding another outlet for that type of reaction. I do want to put a point that if you're experiencing those symptoms, the typical trajectory is that they get worse right after an event, and then they get better over time on their own. As I mentioned, we're very adaptive creatures. But if those symptoms are lasting a long time, that's definitely a point where you should potentially seek more professional support as well. And obviously, we're certainly pro getting support earlier on in the process as well. Okay, so we've got a little bit of background now in terms of what might be going on for you in this time. Want to talk now a little bit about strategies that could be helpful in this time. So let's take a minute to talk about what we call the cognitive triangle in the therapy world. If folks are familiar with cognitive behavioral therapy, this will be familiar to you. But essentially, what we know about the way people work is that our thoughts, our emotions, and our behaviors are linked. So what we think about influence how we feel about it, influence the behaviors that we engage in. So I think a very simple example, if you're lying in bed and you hear something fall over in the next room, if your thought is that someone is breaking into your house, your emotion might be fear, might be anger, anxiety, and you might call the police, right? So there's a very easy to see chain there. If your thought is, my cat knocked something over, your emotional response is going to be very different. You might be annoyed, amused, and just go right back to sleep. Same situation, but what's changed is our interpretation of it. And so throughout the rest of this presentation, this conversation, we're going to be talking a lot about different behaviors you can do to manage stress and anxiety, different thought exercises you can do to manage emotions, because these are all very, very interconnected. In that situation, if you run out to your living room with a baseball bat in your hand, you're probably going to increase your anxiety and change your thoughts. So that's just a little bit of a preview of setting the stage for what we'll talk about. So the first thing we're going to explore is behaviors. What can we do from a behavioral standpoint to manage the stress that we're experiencing at this time? So the first area is really around maintaining your healthy routine as much as possible. So eating healthy foods, getting exercise, enough sleep, drinking enough water. If you're able to get out into nature, be around green spaces, that can be really, really helpful. Um, Exercise for folks who are maybe having to be in their homes, that can be a little bit trickier, but logging onto the internet, finding a yoga video, running on the spot for 30 seconds, whatever you can do to still keep up these healthy habits or start these healthy habits is going to be really, really helpful. Extending your exhales. We did that at the very beginning with deep breathing. When we breathe out for longer than we breathe in, we tell our bodies it can relax, that things are going to be okay. And that's going to be really, really important for your long-term health as well. And then laughter. It's a very serious time. Finding ways that you can connect with people, connect with yourself, folks around you, and just laugh. Now might be the time to watch some comedy, engage in some humorous activities instead of maybe some very serious ones. Another important piece, a lot of folks might be working from home or at least in very more quiet settings, so it's hard, our routines are thrown off. Consistency can really, really help in times like this. And so that's when we would say just try to maintain consistency as much as possible. What are the parts of your routine that you can stick to? Maybe it's waking up in the morning, having coffee, getting ready in the same way that you would if you were going to work, but then just moving to a place of your home where you're going to work from home. Know which parts are going to change temporarily. So maybe you don't have a commute, or maybe you're not going to be around people as much. What can you do to prepare for those? It can be helpful to think about this as a temporary change. I think there's a lot of kind of panic and stress around there that this is going to happen and going to go on forever. As far as we know, nothing has lasted forever. So we know that this will likely be temporary. We don't know what temporary means, but just thinking about this as a temporary change that won't be forever. And then revisiting this routine, seeing what you need to change, what's working, what's not working. Been chatting to a lot of folks about, maybe they're working from home and things are totally off and they notice, okay, I need to make sure I get up at a particular time still, or talk to people at a particular time, have a virtual lunch, whatever it might be. If you're working from home, if you're able to do that, making sure you have a separate space to do your work. Even if it's not a separate room, it can be very helpful to have a place where you do your work and a place where you kind of live the rest of your life. Otherwise, it's very easy for those to blur and to blend, and kind of stress might increase there. Being disciplined about your time, the boundaries are maybe a little bit more blurry, so putting reminders, setting alarms, etc. I think now is an unprecedented time. I think this was happening 3 to 5 years ago. There would be far fewer ways for us to collaborate and stay in touch with people, even if we are remote or a little bit more isolated. So whether you have Slack, email, things like Zoom, using those as much as possible to stay connected to the people around you. I will say I've been really pleasantly surprised by how much community building that I've been seeing happening over the last week. Humans are very social creatures. We need interaction. And so it's been a great way for people to say, hey, this is something that's really important. I want people around me and I want that type of social support. So setting up times to chat with people over video can be really, really helpful. And then finally, taking breaks. If you're able to walk around your house or out in the neighborhood, keeping that distance from others, that's recommended, but getting some fresh air, moving your body, as much as possible is going to be really helpful. Social support in a time like this, I've stressed that already, I'll stress it multiple times. Talking to the people who you feel comfortable talking to, whether that's friends, family, loved ones, spending time with them, really committing to doing that, even though it might be harder because you can't see them in person. Finding support groups that you can talk to people with. And then also seeking professional support. So I know we have folks on here who might have modern health as a benefit, some might not. We really encourage you to take advantage of your benefit in a time like this. If you have modern health for coaching or therapy, And for folks who don't, reaching out to insurance networks, reaching out and getting additional support in times like this is going to be incredibly helpful. Okay, I promised us that we would sprinkle some relaxation techniques throughout this presentation. So this will be our second one. This is guided imagery. We practiced deep breathing a little bit earlier. So the goal of guided imagery is to think of a really, really relaxing place. The most relaxing place you can think of. Maybe it's somewhere you've been or just somewhere you know will be really relaxing. I often use the imagery of a forest. You can feel free to think of a beach, a lake. I had a client once who, for those who have been to San Francisco, downtown Market Street, that was his place of relaxation. So whatever works for you, feel free to substitute that in as I guide us through this forest. What's really, really important here is to think about all the sights and sounds and smells that would be there. Really immerse yourself in all 5 senses. And if you get distracted, just come right back to those 5 senses. So if you're comfortable, I'll welcome you to join me again. Getting into a comfortable position wherever you're sitting, allowing your eyes to close, and starting by taking a couple of deep breaths. And now I want you to imagine that you're walking towards a beautiful wooded forest filled with tall trees, green leaves. Notice, pay attention as you're walking to the feeling of ground beneath your feet. Maybe there's soft grass, the crunching of leaves. Notice any other physical sensations. Maybe it's wind blowing across your skin. And then starting to notice everything you can see. Tall trees reaching to the sky, branches covered with leaves, the grassy floor, leaves scattered on it. You can notice all different shades of green that you can see. Noticing all the sounds around you, the wind rustling through the trees. Maybe birds in the distance. Notice anything you can smell, the nice fresh smell of nature, leaves. And just allowing yourself to walk through this forest for a few more moments. Noticing the feeling of wind, maybe the dappled sunlight hitting your skin, your face. And every time you get distracted, just bringing yourself into the senses. What do you see? What do you smell? What do you hear? Taking a couple more moments to explore this forest. And then bringing your awareness back to the room, back to the present moment. Maybe giving a big stretch. Hopefully you're feeling a little bit relaxed. Feel free to post comments, reactions, questions about it in the chat as well. And before we move on, we got a really wonderful question in our chat. Advice for dealing with negativity. If folks in your circle have a negative spin on what's happening, blaming others, how can you both support them while not letting it get to you? So I think this is a great question. So let's just tackle this right now. I think the first part is how can you support them is by validating how they feel. So letting them know that you understand how they feel. So if someone's saying, I'm so overwhelmed and so stressed, it can be really, really supportive to just respond by saying, sounds like you're really stressed. That's understandable in a time like this. And maybe that's all they need, right? They felt heard. They feel like you're supportive, you're listening to them. If folks are kind of continuing to negative spiral there, what's nice is to just use a little gentle pivot to say, sounds like you're really stressed and overwhelmed. And what can we do to distract you? Or what can we do to focus more positively? Having that acknowledgement come up front can be really, really helpful. It's also totally okay to be a broken record. If someone is saying the same worry over and over again, it's totally fine to just respond with the same thing over and over again. It sounds like that's really stressful. And why don't we take a walk? Or it sounds like it's really stressful, period. Right? And oftentimes that will peter out. I think if you can also offer some additional supports in terms of problem solving, getting proactive, right? Let's go for a walk, etc. That can be really helpful. Depending on the friendship you have, if you can offer support, I know this is stressful, and I've noticed that you seem to be really taking it hard or dwelling on the negative. Is there any support you need, or is there anything we can do to get you shifted out of it? By leading with support, they're less likely to become defensive. The other piece I would say is for the second half of how do you support them while not letting to you, making sure you're there are things that you need to put in place with this person. That's your own mental idea. Whether that's saying, I really understand you're having a hard time. It's difficult for me to keep hearing about it. So let's kind of shift topics, or let's talk again maybe when you're in a little bit of a better place. A little bit fuzzy there again. So just repeat this again. So lead with offering support. And then it's totally okay if you need to set up boundaries. If you can't have the same conversation over and over again, saying, I know this is really stressful for you. It's overwhelming for me to keep hearing the negativity. Can we change topics? Or maybe let's get together a little bit later. Let me know if there's any part that you want me to repeat in particular as well. Another question about what we can do if there are people who are high risk that we care about, maybe that's parents who won't listen to how big a deal this is and aren't preparing and self-quarantining. I think this is one of the biggest challenges as a human. We can't change somebody else's behavior. As much as we can calmly really repeat what we think is important and just repeat it over and over again, saying, I really care about you. This seems like a serious situation. I want to make sure you're taking the steps to prepare. Sort of making that case for what you think they need to do and why, right? I really care about you. I want you to stay healthy. I think it's important for you to do X, Y, Z. Make that case, but also know that we can't change other people's behavior. It can be helpful to be really clear in what you think is going to be best for them, and also why it's important to you. You love them, you want them to be safe, but also acknowledging that there's only so much we can do. We can't change other people's behavior. These are really fantastic questions. Please keep them coming, and let me know if I haven't fully answered a question that you've asked as well. So one thing I want to really talk about, if you remember the cognitive triangle we talked about earlier, thoughts play a really, really huge role in how we respond to something. So all of our minds have these different ways of thinking. We typically call them thinking traps. And our mind maybe just tricks us a little bit or doesn't respond as helpfully as common ones. And so I thought I'd go through these a little bit. Some of these might resonate with you. I often say I've had clients or myself, you might start thinking the worst. Some people are generalists. I'm a generalist. I have a few of these every once in a while. Some people are specialists. So as we go through these, start to notice about how your mind works, what thinking traps you tend to fall into, and then we'll talk about some strategies. So I think one of the biggest ones that's probably coming up now is thinking the worst or catastrophizing, right? So things are always going to be like this. The world is never going to be the same, etc. Right? So we're taking what information we have now and extrapolating out to the worst possible outcome. Jumping to conclusions is really similar, right? Because something has happened, we assume we know what the outcome will be. Black or white thinking is a huge one related to perfectionism, stress, anxiety, right? Things are either one way or another way, right? This is going to be a disaster or this is going to be completely fine. Usually things are in the gray, in the middle. Emotional reasoning, I think, is a huge one that's coming up right now. Essentially, emotional reasoning is saying, because I feel a particular way, that means that something is true, right? So because I feel anxious or because I feel panicked, this means that it's right to panic. So there was an interesting question in the chat that came up, like, how do you stay calm when you go to the supermarket and you see people panicking, right? It's easy to say, because people are panicking, this must be really stressful. That's not necessarily the case, right? Sort of acknowledging that the panic reaction itself is not helpful and it doesn't necessarily tell us how we should be behaving in this situation. And again, going back instead, what are the guidelines? What are the recommendations? Fortune telling, thinking we can predict the future. Mind reading, thinking we know what other people are thinking. And then should statements, or minimizing the positive. So should statements are things like, I should do X, Y, Z, I shouldn't. If you hear that word should come up, that's a good flag to just pay a little bit more attention. And then minimizing the positive. So if something good has happened, we kind of throw it out because we're in an anxious state. So one positive that I've seen come out of this situation is people coming together and communities banding together, people supporting each other. And sometimes it can be helpful to remember that there are positives in a situation. Things are rarely one way or the other. So let me answer a few of the questions that are coming up in the chat now as well. So we talked about, we see people panicking around you. Taking a deep breath, noticing that they're panicking. Just because someone else is panicking doesn't mean you have to panic. It doesn't necessarily say anything factual about the situation. So separating out kind of emotions and rationality. There's another question of, what do you do if you're doing deep breathing for stress relief and negative thoughts come to your head? I love this question. This is a really good question. I would be surprised if you were doing deep breathing and your mind was totally blank. So there's a couple of different options here. One is just to acknowledge the thought that's coming up, like, okay, that's what I'm thinking about, and then redirect your attention back to the deep breathing. The other option is to give something else for your mind to do. So it's hard for our mind to do multiple things at once. So if you notice a lot of thoughts coming up, counting your breath. So 1, 2, 3, 4, 1, 2, 3, 4, 5, 6. Give something else for your mind to focus on. And we'll talk about one more strategy in a second here. So another question about, how do you remind yourself about these thinking traps? So you can have this list in front of you, and every time you notice that you're stressed, see if you can identify the thought and then see, okay, does this fall into one of those thinking traps? And sometimes just slowing down and noticing can be really, really impactful of like, oh, okay, this is what's going on. This is the thought I'm having. And that's enough to diffuse the situation. So you'll all get access to these slides. Print this out. If you have Modern Health, we have this in the app as well. And just anytime you notice you're feeling overwhelmed or stressed, see if you can notice what thought it is, and then look through this list and say, okay, this is catastrophizing. Sometimes that's enough. If it's not enough, we'll talk about a strategy in a second here. And the more you do this, the more automatic it becomes over time. I had another question about, how does something like expect the best but prepare for the worst work here? And if not, how to restructure it? I tend to think that that is a helpful thought, as long as it can stay not anxiety provoking. So I think a lot about, what impact is this having? There's no good thought or bad thought. It's just, what impact is this having on you? So if you have the thought, prepare for the worst but expect the best, and that helps you stay calm, that's fantastic. No need to change that thought at all. But if that causes you more stress, then you can change it to say, We don't know how things will turn out. I'm going to do the best I can now and monitor the situation over time. Try to keep things as realistic as possible. I had another question about how do we remember this in the moment? It's totally okay if you don't remember these thinking traps in the moment. After the fact, when you're like, wow, I was anxious at the grocery store. Once you've calmed down a little bit, go to these and think about it. The more we practice, the easier it becomes to do over time. Someone is asking, does ignoring negative thoughts give them more power? Do they have to be realized or acknowledged? I absolutely love this question. So we can't get rid of thoughts, right? So I'll ask a little exercise. I'll ask you all to not think of a white elephant. What are you all thinking of? Probably a white elephant. And even if you're not thinking of a white elephant, maybe you're thinking of a purple elephant. The only reason you're doing that is because it's not a white elephant, right? So we can't just get rid of thoughts. That's not necessarily going to help. But what we can do is notice them, acknowledge them. Okay, I'm having the thought that I'm overwhelmed. Create a little distance. What we want to do is not to get totally caught up in it. So as soon as you can just acknowledge the thought, notice that it's just a thought. It's not necessarily true or false. Can be really helpful. There's also this exercise called cognitive challenging. So you notice the thought that you're having. So maybe the thought is everyone's going to get sick, right? What facts do you have that this thought is true? And what facts do you have that this thought is not true? So on the facts that this thought is true, you might say this is a contagious disease. Lots of people seem to be getting it. On the not true side, it might be I'm at low risk. It hasn't spread that much yet. I'm taking all the necessary precautions. And then you find a nice balanced, realistic thought. So it's possible I might get sick, but I'm doing everything I can not to. We just want to take a moment to slow our thinking pattern down so that we don't immediately go to crisis mode. Let me pause there for a second. I know there's a lot of questions about CBT. If you have access to the Modern Health app, we have a full 8-part series. So feel free to dive into that, get a lot more resources around that, and hopefully that will be helpful. I'll put another plug for working with a coach or someone like that on these different thoughts. Someone else is asking a really great question. Sometimes because of all the information and exposure to the information on social media, people start to feel stressed and you start to feel a little bit sick and start to assume that you're having the illness. So I think there's 2 pieces there. One is, again, putting some limits on the amount of time you're spending on news sites, on social media, reading about it. That's typically going to be increasing your anxiety. And then the second piece is when we pay attention to our body, we can find symptoms there all the time. So there's something called first-year medical student disease, right? Like as med students are learning about all these illnesses, they think they have all of them. That's just the way our mind works. Noticing that you're doing that and paying attention to what's the reality, what are the facts? What are the symptoms you're having? How are those changing over time? And then consulting WHO, CDC, your physicians, if there's really something to worry about. A great question about how do you balance taking precautions and not taking too many precautions out of worry or anxiety and not living your life. So I think the answer is right there in the question. Is this interfering significantly with your ability to live your life? Are you not able to do your work? Are you not able to connect with people because you're taking so many precautions? The other piece is just looking at what the guidance and the recommendations from reputable sources are. And are you following those? We want to look at what's adaptive based on those factual recommendations, based on what most people would and could be doing in this situation. And if you start to notice that you're doing more, so if you're washing your hands every 5 minutes, just learning to slowly cut back and again, reach out for professional support if it's hard to do that on your own. Really fantastic questions. I appreciate you bringing them up. I want to talk a little bit about mindfulness as kind of our final stress management strategy here. Folks might have heard of mindfulness. It's become really popular over the last few years. Essentially, mindfulness is non-judgmental awareness of the present moment. So there's a lot in there. Typically, a lot of distress comes from thinking about the past, worrying about the future, I think particularly in times like this. So taking a moment just to notice what's happening in the present can be really helpful. And then not judging ourselves or not judging ourselves or not judging our experiences. And I think that can be particularly relevant at a time like this. So let's practice just a couple of minutes here, and then I'll respond to all the questions that have just come up on chat as well. So if you want to just take a couple of seconds to center yourself again, shutting your eyes if that feels helpful. And notice your breathing in this moment. Paying attention to the physical sensations of breathing. Maybe noticing your chest rising and falling, or your stomach expanding and contracting. And noticing when your mind wanders. Maybe you're worried about being isolated. Maybe you're worried about parents getting sick. Just noticing where your mind has wandered to, and then bring your awareness back to the physical sensations of breathing. And each time you get distracted, just gently acknowledge where your mind has gone and come back to the physical sensations of breathing. And if you notice that you're feeling anxious or overwhelmed, pay attention for a moment to the physical sensation of that anxiety. Maybe tightness in your chest, shakiness in your hands. And notice that it doesn't stay the same. No emotion has ever lasted forever. And then now taking a couple more deep breaths. And opening your eyes, coming back to the room. So that was a very, very brief exercise in the interest of time, but hopefully you can see a little bit of how it works. Again, there's lots of meditations on our app. If you're not a Modern Health user, that you can find them on the internet as well. Just really focusing on your breath, your breathing, noticing the physical sensations as they change over time. With the 2 minutes we have left, I'm going to just answer a couple of these last questions that have come up. Someone's asking, particularly with young kids, it's hard to know which are practical, which are overprotective. I think that's a totally understandable response. Again, looking at what impact it's having on your life, looking at reputable sources, what do they recommend? And noticing too, if you're doing something from a place of rationality and fact basis, or if you're doing it from a place of panic. And if you're doing it from a place of anxiety, maybe pausing for a moment and redirecting, thinking about what would be the rational, the fact-based thing to do here. Another question about if we're denied testing, how do we ease our own worry or stress about our risk to others? So I think this is something that's coming up for a lot of folks. Again, following the recommended guidance, whether that's quarantining for 14 days, but then practicing cognitive challenging, practicing deep breathing, guided imagery, whichever of these really resonated for you. Notice when your mind starts spiraling and pick not to go down that pathway. Instead say, I'm going to do a cognitive challenging exercise. I'm going to go for a walk. Maybe it's just around your apartment if you're quarantining. I'm going to focus on something else here. Final question that we have time for. Someone feeling alone and cut off from everybody. How do you not feel alone this temporary isolation? Take advantage of the benefits of technology, right? So reach out, set up video calls, set up group messaging, whatever we can do to mimic that in-person closeness. I know a lot of folks at companies are just having standing meetings with their team every day where people can just pop in. So I think we're fortunate to have technology in times like these, so make sure to take advantage of it. We are coming up on time here. Really, really appreciate you all taking the time out of your day. hopefully you're feeling a little bit more relaxed. We'll make sure that you have access to the slides and the recording. Again, apologies about some of those audio difficulties. If you are a Modern Health member or you are at a company that has Modern Health, please take some time to register and get connected with resources, whether that's the CBT program or a coach as needed. So I'll end there, but thank you all so much for participating, and please reach out with any questions. Be safe, everyone. Take care, and make sure to take some deep breaths.